As WALT Congress 2023 draws to a close, we need to be looking at how all of the knowledge, all of the networking that we've gained over the last 3 days can be turned into moving PBM into the mainstream of medicine and health and wellness. And so to figure that out, we're going to talk about penguins. Almost all of us have seen the National Geographic or other shows regarding how baby penguins all gather on an ice floe and trying to figure out when to go into the water. And then once, at some point, 1 or 2 little baby penguins jump in the water, and then all the rest go roaring into the water at the same time. We need to find a way to have the decision makers in the healthcare industry, in government, in the insurance industry, in the academic area, to take the PBM plunge. And that's what this discussion is all about. Let's see. So we've had a lot of major advances in the last 2 years, and that gives us not only the successes that are going to push us forward, but gives us examples of how you actually take what we've learned and move it to the decision makers and get those decision makers to embed PBM in mainstream medicine. So a couple of years ago, we've had the Multiple Association for Supportive Care in Cancer recommended PBM as the prophylactic to prevent the horrible side effects of chemotherapy. And since that time, we've had major cancer centers begin to actually embed them, institutionalize PBM in their standard order sets. University of Pittsburgh Medical Center was one of the lead ones. They've actually now treated over 3,000 cancer patients. But the real gold standard is St. Jude. St. Jude is the leading hospital in the world for pediatric cancer. And they have, again, like the other hospitals, made it standard operating procedure, standard order sets to treat their pediatric patients. We're talking 4-year-olds, 5-year-olds with cancer with PBM. They actually have developed devices that look like lollipops or popsicles so that the kids feel more comfortable having the device delivered. When you can go around to decision makers and say, even 4-year-olds, even a place like St. Jude, sees that children are this safe using PBM, that is a huge battering ram to get people to understand how safe it is and how effective it is. The military, in the last couple of years, every major Western military is now using PBM for conditioning, for recovery, and for performance. We got NATO, we got the United States, we got Israel. So once again, we're building our footprint. 4 major victories in just the last year. Let's start with the FDA. This last March, the FDA closed its public comments on a new expedited process for clearing PBM devices. But the most important thing is, after literally decades of mislabeling and misdescribing PBM, we now have an accurate description of PBM embedded in the Food and Drug Administration in America. Center for Disease Control. 2016, they created a opioid guidance, prescription guidance, which they had to revise. After numerous testimonies and submissions of evidence, the CDC in January of this year, which is really, key, a lot of other countries key off of it, has recommended that PBM is the preferred alternative to opioids for pain management. Huge. Took us 5 years to do that. Journal for American Medical Association. Last summer, they published a very large study on lower back pain. They have a chart in their JAMA publication. And that chart shows PBM as the preferred treatment for lower back pain. Again, these are the things that we're trying to build. We want to basically ingrain PBM in mainstream medicine. This is what it's all about. Another big one, Veterans Administration. The Veterans Administration of America 2 years ago, after an amazing study at the Boston VA of 214 veterans that have had traumatic brain injury. They basically got hit with a roadside bomb, and their brain, they survived, but their brain was in bad shape, and the opioids and other treatments basically led many of them to suicide. The success of PBM treating traumatic brain injury in Boston led to a national recommendation by the National Center for Compassionate Care Innovation to recommend PBM as the preferred treatment for traumatic brain injury. There's like 375,000 veterans in America with that issue. So what they did was in Boston. They're doing it also at the Denver VA and in the Salt Lake City VA. There's 171 VAs, hospitals, another about 1,200 clinical walk-in clinics. What the beauty is that the devices that they're using is cheap enough that they're handing them out to the veterans for them to go home. They don't have to come all the way into a veterans hospital anymore. Our goal is to get it into all 171 hospitals. Once again, concept that we're going to be talking about in the next minute or two is think of every victory as a beachhead. We have to expand on it. We can't just simply rest on our laurels. Here's the actual verbiage again. You'll be able to access the slides on what the VA actually recommended regarding PBM and traumatic brain injury. Another part of taking our knowledge, and we actually had some wonderful stories in the last 3 days, how do we put a human face on PBM successes? We're going to have a tale of two patients. The first one is the Pope. Last year, he bashed his knee, literally shattered it. He was concerned about going under general anesthesia. We were able to reach out to the Pope's physicians and treated him with PBM. It was so successful on binding his knee and going from literally a wheelchair to walking again, that he actually held a special service in Budapest to thank the family of Andre Mester, which of course many, I'm sure you've heard all the time, is the discoverer of PBM back in 1967. So in the main basilica in Budapest, he handed out a Vatican medal, papal medal, to the family of Andre Mester. And he went on all the TV stations, ITV from Europe, England, all the Eastern European. He said, the only reason I'm walking is because of light therapy. So think about that endorsement. So another case, as Lou Lim mentioned, brain fog coming out of COVID is a huge issue. We are working with an Olympian, this amazing person named Anne Abernathy. She's going for her 7th Olympics in Paris, and she's now one of the top-ranked archers in the world. Last summer, she got brain fog. Had she taken the drugs recommended, she would have been drug screened out of competition. She instead became part of a clinical study for PBM, and it worked like a charm. So literally, after only 14 minutes of treatment, this is how much the brain fires up. This is now being expanded again, like with Lou and others, to, again, bring PBM, in this case, into the Olympics. But all the success basically puts us at the base camp. We have a long way to go. As of a year ago, several Wall Street analysts looked at the PBM market. They're saying that if we had full implementation and adoption of PBM, it would be $1 trillion a year industry. And when you look at the companies that are represented here or referred to in some of these case studies, we're probably less than 1% of that. There's a long way to go. So the key is how do we navigate up that mountaintop to get to that $1 trillion industry? The first thing is reimbursement. In America, other countries might have national health. They need to cover PBM. In the United States, Blue Cross Blue Shield, they have 34 affiliates. Half of them are now covering PBM for oral mucositis. We still need to expand. Kaiser Permanente, a few of their affiliates. We still have a long way to go in America. But one of the big ones for us is Medicare. Americans are getting older. And this is literally a couple weeks ago, Medicare is now covering acupuncture. So what we want to do is get a similar designation, national coverage designation it's called in America, for having, instead of saying acupuncture, we want PBM up there. And that's, again, interacting with the policymakers, interacting with the stakeholders, interacting with the media to convince people that that's where we need to go. The big problem is, in 2006, a company called Anodyne had a flawed device, and it started burning people's feet. So the Medicare officials basically came up with a negative coverage determination. And so we have to overcome that. In the last 2 years of negotiation, I've gotten the agreement for Medicare to revisit PBM coverage, but we need to work on getting the evidence to them in the right way. American Medical Association, we still don't have a CPT or coverage code. So this, if you have one slide to print out and keep with you and take a photo of, it's this one, because this is the roadmap that we need. We need to figure out who are the decision makers, the influencers, the people who are going to help us institutionalize PBM. And then we need to wrap a reality around them. I call it the echo chamber. Just a couple examples. Many of you are in institutions, many of you are in hospitals. You may be in only one department of that hospital. We need to use that to expand to all the departments of the hospital. You may be in one part of a university. We need to expand to all of it. A key one in the hospital world is called grand rounds. Most hospitals in the world have, at least on a monthly basis, a 1 hour coming together of people throughout the hospital where individuals elsewhere in the hospital share new technologies, new procedures, new insights. We should be in every hospital that we are currently operating in, even if we're just over in the rehab area or the cancer area, do those grand rounds because everybody attends. Obviously, social media. We came up a couple years ago through the PBM Foundation with a hashtag PBM Heals. If you are posting photos of this conference on LinkedIn, on Twitter, on Facebook, use that hashtag PBM Heals. We want to get that drumbeat out there. So another piece, we need to be in more mainstream medical journals. You know, people talk about 6 degrees of separation. That was many years ago before the internet. Most of us know that, especially with the internet and social media, it's 1 or 2 degrees of separation. We need to go into all these publications and look at their editorial board, look at their advisory board, and find somebody who knows them. You might even know them, and start to educate them on PBM. You have groups like National Journal of Medicine Journal Watch and groups like Practice Update. These are web-based aggregators, and they have editorial boards and advisors. We need to educate them so they start grabbing these wonderful articles that have been talked about here over the last 3 days and get them in these aggregator websites. The key is no one thing is going to break through, get those penguins into the water. So Buckminster Fuller talked about that on a big ship, you have a big rudder and a small rudder, which is called the trim tab. We are all potential trim tabs. We need to be out there taking the small steps, the links, and all the rest to turn that rudder and turn the ship of world health in our direction. So, one key thing. We all talk about the electron transport chain, and there's whole books written on it. When I'm doing my presentations to lay audiences, because I'm a lay person, And they say, well, what is really the mechanism of PBM? How does it really work? And so what I do is I say, well, you got the electron transport chain. You got 4 steps that ultimately turns at the subatomic level, a little energy engine that drives the mitochondria, that drives the cell. And all the nutrients come in. And when we're ill, when we're injured, when we're getting old, it gums up and it swells, and that's where inflammation is. You bring in PBM, unblocks. I used that with the Senate Appropriation Committee 2 weeks ago, and their chief scientist said, now we get it. Yes, it is superficial. Even that's superficial, because people like Praveen Irani and Juanita Anders and others are creating much more complex things and finding every day additional insights on what happens at the subatomic level. But if you're sitting across from a reporter, a policymaker, an elected official, I mean, everyone here can look at their ministries of health, their parliament members, and they say, well, what is this really? Bang, bang, bang. Just like Dr. Spock with this, now we have our own. So the PBM Foundation works closely with WALT. In fact, both Renee Jean and Praveen are board members, and Liebert's a board member. We have people, we work very closely. Where WALT is an aggregator and a curator of knowledge, we are the disseminator of knowledge. So we work hand in glove as another nonprofit to try to get the word out. So look at these slides when you get home. Look at our website, pbmfoundation.org, and we're always here to help. So I thank you much.